Burnham.
On Friday, the Prime Minister promised no more amendments. Yesterday lunchtime, the Minister of State said the whole of government backed the bill as it stood. Yet hours later, the Deputy Prime Minister called for changes to a flagship bill that he has supported all the way. The government appears in complete disarray. Or maybe it was pre-agreed coalition choreography to save face for the Deputy Prime Minister. Either way, this House is entitled to ask, what's going on? The NHS matters too much for us to allow it to be carved up in the unelected House in cosy coalition deals. Did he consent to this apparent change of policy, or was he overruled by the Deputy Prime Minister? Who is in charge of health policy? Is anyone in charge? Second, on policy. Will he update the House on the precise detail of the changes the Deputy Prime Minister is seeking? Yesterday, Liberal Democrats played up the changes. His own department dismissed them as minor. Is his view the same as ours, that these amendments do not affect the substance of his bill, but rather are cosmetic changes designed to make the Deputy Prime Minister look good in advance of his spring conference? Last week, the President of the Lib Dems spoke for his party in admitting the bill should have been dropped. Doesn't that explain what this posturing is all about? That in their heart of hearts they hate this bill, but haven't had the guts to stand up to the Prime Minister and say so. Both coalition parties are putting their political pride before the best interests of the NHS. Isn't it time to do what they said they would do at the start? Listen to doctors and nurses and drop this bill.
Mr. Secretary Lansley.
I'll tell you exactly what the process is. The process is, in another place, for there to be detailed discussion. There were 15 days of debate in committee in another place. It is the habit in another place not to amend the bill during committee, but to use those debates in the committee as a basis for amendment at report stage. And the process is very straightforward. My right honourable friend, together with Baroness Shirley Williams, was explaining to their Liberal Democrat colleagues some of the amendments which we have been working together on in order to make sure there is further reassurance. That is literally true. The purpose of the bill is to achieve quality. Where competition enables us to deliver better quality for patients, we should use it. Where integration of services and an absence of competition is in the interests of patients in delivering quality, then that is the basis upon which the NHS should proceed. The bill has been tremendously strengthened and actually is now a long-term sustainable basis for the NHS to deliver the quality of care that we're looking for patients while maintaining all the values of the NHS.